So to ensure that we standardize and ensure that those services are provided, whether it is at a secondary or a primary facilities, the basic package of the maternal health services are provided, and also for the child health services. But then again, knowing the terrain and other things, the facilities were also empowered to provide outreach services. So on a weekly basis, they go out to catchment communities to also provide outreach services. So with all this, and then of course on quarterly basis, the state organizes what we call state integrated outreach services. So what we do here is that we organize widespread statewide outreach services that covers both MNCH, including immunization activities. So where those that are missed, and those that are unable to attend or so on, are actually reached with those services. And with all these interventions, we, of course, have to see how we can measure the success of these interventions. And the recent multiple indicator cluster survey has actually revealed that although we are not there yet, but there has been significant improvement in the coverage and uptake of those services. In the sense that when you look at the Penta 3 coverage, it rose from a figure of about 9% in 2015 to about 65% in the recent mixed-NICS survey. When you look at all the other immunization indicators, you find that the state has actually recorded up to, in some instances, up to 85% improvement in the coverage of the immunization. And when you come down to the other maternal indicators like antenatal care coverage, you'll find that we have improved in terms of, let's say, when you talk of antenatal care 4 coverage, you find that the state has risen from a figure of less than 20 to 30% to about 49, percent. Skilled birth attendance increased from 14% to about, about 49 or so percent. And then institutional deliveries rose from about 7% to about 48%. So you can see that wide improvement. Even family planning was of course, significant improvement was also recorded, in the sense that from a figure of less than 6%, you've risen to about 18%. So when you look at the percentage difference or the percentage increment, you see that there is a lot of improvement in that. So that goes to say that these interventions are actually working, and the state is also continuously working hard to see to it that we consolidate on these achievements, and then of course continue to reach, because our target basically is to actually achieve 80 to 90% uptake of all these indicators.
All right, can you tell us what the government is doing to improve tertiary health in the state?
Yes, the government of His Excellency Honorable Memala Buni, being a government that looks at everything full package, has actually worked again to ensure tertiary health is provided. Like I said earlier, in each of the zones of the state, one general hospital was upgraded to be a specialist hospital. So as it is now, in Bade zone, we have the specialist hospital Gashua. In Potiskum zone, we have the specialist hospital in Potiskum. In Gaidam, we have that in Gaidam. In Bunyadi, we have, and then of course in Damaturu, we have the specialist hospital here in Damaturu. Again, a specialist hospital will not answer its name unless you see the specialist coming to provide services. So again, on local arrangement, of course, we have that. And then the equipments and necessary supplies were also provided. In addition to that, there is the Yobe State University Teaching Hospital, which was also established. And then, of course, His Excellency further enhanced the activities and services there. In the teaching hospital, in addition to the manpower, where we've gone as far as Egypt, Palestine, and other places, to bring, the necessary manpower in addition to the indigenous ones. Then the other thing is that The government also, enhanced some of the equipment and added additional equipment in those in that facility. So as we speak now, in the teaching hospital, I think we have the only functioning MRI machine in the zone. It is a 1.5 Tesla MRI machine, and it has been functioning, and not even once has it actually broken down. It's there providing serving, and we receive clients from as far as Taraba and other parts of the country that come here. It is also very interesting to note that because the government always looks at how to ease healthcare to the population, the cost of the services are put at very, very affordable rates. MRI in Yobe State is about just 45,000, depending on the investigation, but the highest you will pay is not, the range is not too wide, where it will cost almost twice or three times that in some other locations. At the teaching hospital, we have the 128 slide CT machine, which has been upgraded to provide other other sophisticated investigations such as CT colonoscopy, angiography, and so on and so forth. They have other machines such as the fluoroscopy machines, state-of-the-art X-ray, ultrasound. Name every investigation, it is actually provided there. In addition to that, an MNCH complex was also established. And that MNCH complex has also been equipped. All the necessary equipment that are needed to provide tertiary MNCH services are already there and currently being installed. We are looking forward to its commissioning, hopefully by next month or the upper month at the latest. So all these are efforts, towards enhancing tertiary care. And like I mentioned, to sustain that and to ensure that our indigenes are here to continue the story, they are also sent out on tertiary care training. So when they come back, they are actually posted to to the tertiary health facilities to provide specialized services.
All right. Funding is a criteria in terms of provision of health to the people. Can you share with us how have you been able to sustain funding?
Yes, His Excellency is somebody that actually always thinks outside the box, despite all the fiscal difficulties that have been faced, with the COVID-19, inflationary trend, and so on. The government of His Excellency has actually been very, very prudent with its resources. And then, of course, the spendings have been channeled to the needs. It's not just done the spendings are done and in a very prudent and so efficiency has been inculcated in the system. The other thing is that partnerships are also built, with our donor and implementing partners. So when they do come, we actually sit and look at what are the priorities of the state, what are their own priorities, so that we can align and synergize our resources to continue. Every funding that comes to the state, whether it is a grant or whether it comes in the form of any kind of support, we jealously receive and guard it, and of course channel it to the purpose for it to benefit the people. And the other thing is that we also look at other innovative financing mechanisms, things around such as the contributory healthcare scheme, which looks at both financing on the supply and the demand side. The state also looked at, okay, how can we ensure that we have sustainable financing of drugs and medical consumables, and as such, the Drugs and Medical Consumables Agency was established, and they went into public-private partnership with the pharmaceutical manufacturers. So, of course, these are provided, and then, of course, using the Drug Revolving Fund Scheme, injected with private sector ways of doing business, you now see that these are revolved, and then of course so the facilities are able to have that critical mass of funding that they need to be able to provide the services, ensure that we have adequate supply of the medications they need, and then of course the system is also able to manage itself. So basically, these are things that we do in a nutshell to manage the resources that we have.
All right, lastly, what more should the people expect from this administration in terms of health?
Yes, you see, His Excellency always is a forward-looking person. Always his desire is to see how we can, raise the bar in terms of healthcare service. At the lowest level, as you have heard, we are empowering and enhancing the systems at those levels. At the tertiary level, we are continuously looking at what we will do to make, to reduce very significantly, medical tourism outside the state. Already we are in talks with some centers to see how we can, because we know the renal problems are there, to see how we can bring renal transplant down to the state. We are looking at what we can do to go into partnership with known facilities outside in India, Dubai, and other places to see how we can have that relationship with them, where they can come, and provide subspecialized services in our teaching hospital. His Excellency continuously looks at how he will be able to establish additional services like cancer, cancer care in the state, where we are already in talks with partners to see how we can go into partnership for the establishment of cancer care here in the state, and many more. In terms of human resource for health training, continuously we are looking at not only specialized care, but even subspecializations to send our indigents to go and subspecialize in the different areas of medicine and come back to the state and and provide such required services. So all these are efforts at ensuring that healthcare is reached. But the bottom line is that His Excellency wants to see a situation where Yobe State achieves universal health coverage even before the 2030 deadline.
All right, we've been speaking with the Commissioner for Health and Human Services in Yobe State, Honorable Lawan Ghana. Thank you so much for joining us.
Thank you.
Thank you. Thank you so much. That's the much we can take on this week's episode of Impact Yobe. Don't forget to join us next week for a fresh edition of the program. My name is Michael Oshoma. Goodbye.